Looking forward to learning about your company here. So I understand you're working specifically in the field of this company, Trace.
Yes.
And you're based in Bogota, Colombia. I love Colombia. The Bogota folks are wonderful. I've spent a lot of time there. Fundación Hospital, wonderful place. And you're working on a technology that can help patients get care in other places. Tell us about it.
Yeah, exactly. That is exactly what we do. The problem is that in Latin America, access to healthcare is so difficult. It can take you from a day to a week to just talk to a doctor. So what we're doing with our technology is basically enabling AI to optimize doctors' times, but also improve user experience by symptom assessment correctly, because we now know that if we help you identify your symptoms correctly and tell that to the doctor, you'll get a better outcome, medical outcome, right? So instead of a regular consultation that, let's say in our countries take 10 to 12 minutes, the first 3 or 4 minutes are what do you have, for how long, have you also have this or that. So all this symptom assessment is done by the platform itself. Then a triage is performed inside the platform, and the doctor, which is going to talk to you, already knows all this information. So we basically optimize doctor's time, and as I said, improve user experience, and that's why we're able to serve 300,000 people every month, and we keep on growing.
Wow, so you're doing very well in terms of your reach and number of patients and doctors that you're able to help. You know, I've often thought it is kind of strange when patients come in to see you that we ask questions that could be asked before, and we could have a more efficient assessment. For example, sometimes I'll ask a patient, how old are you? Well, that information could be filled out by them before they come in, and instead of spending that time, you know, pulling it out of them, and then sometimes they tell you, well, take a guess, higher, no, it's lower, no, it's, we could be a lot more efficient with information that's shared quickly. It sounds like that's what your company's doing.
Yeah, that's like on the demographics, that's one part. But also, let's say a patient comes and say, I have a headache. So the doctor is going to start like, where the hell do I start, right? Mm-hmm. So the platform is performing, so you have a headache, in the front part, back part, or upper or lower back pain. So it's completely different story. So that's the whole AI symptom assessment that we're doing. It's built on a medical knowledge graph that we're building for a couple of years after serving thousands of questions from users.
And it doesn't replace the doctor, it simply uses screening questions to allow the doctor to be more efficient.
Exactly. Basically what we're doing is, since we're tackling the access problem, what we're doing is amplifying the doctor's capacity. So we're able to serve more and more people. And not only symptom assessment, but then triaging and pre-diagnosis. So the doctor is being assisted by the technology, and basically we can serve more and more people.
Is this your work, Trace? Is it mostly in Latin America, or is it available in the United States?
Well, it is for Spanish speakers. So it is. We're out of Colombia, but we're serving around 200,000 people in Mexico. We're serving around 50,000 people a month, Spanish speaking in the US, which is a big market. We're talking about 50 million people Spanish speaker in the US. So yeah, we're tackling the Spanish speaking population that is roughly 500 million people around the world.
That's great. What are your dreams? What would you like to see done in the next year?
Well, this year we want to see the scale for platform. We're ready to scale. A year ago we were serving 50,000 people. Now we're serving 300,000 people a month. So my guess is that we were able to serve 2 million people a month on our platform.
And what have you learned in the iterative process of putting this out there in the market, getting feedback? What have you been changing based on the feedback?
Well, the business model is always a challenge, especially in our markets that are some years behind. So it's very clear for us that we have a business model based on consultations that can be paid by the B2C users, can be paid by insurers, and can also be paid by employer. So it's basically a simple model, that with a big margin that is enhanced by our AI, which optimizes doctors' time. And that's a big learning, and that's why we're ready to scale.
Okay, great. Javier, great to meet you. Good
Great
luck
to
with
meet
your
you.
company. It's great to learn about it.